Representative Sandra Hollins. She's a Democrat from Salt Lake. She sits on the Health and Human Services Committee, and she is a therapist. She works with young people, with homeless people,
yes,
who are mentally ill. Sitting next to her, Mr. Jason Steveson of the Utah Health Policy Project, a Utah think tank and advocates. I would say they're the smartest advocates in Utah for the Obamacare. They knew more of the, you always went to them if you wanted to figure stuff out. Seated on my left is Representative Jim Dunnigan, a Republican from Salt Lake County. He is an insurance man himself, and he's been the lead up there for years. He's the go-to guy on health issues. And seated next to him, Mr. Andrew Croshaw, who is CEO of Leavitt Partners, a group that consults on healthcare, buys healthcare stocks, and knows about the market. Republican debacle. Did Utah come out better off or worse off?
I don't know that we know yet. In my opinion, some changes really need to be made to the Affordable Care Act. I would have liked to see Congress pass something, or the House, but I'm hopeful that they'll come back with something even better than what they were proposing.
Okay, there were conservatives who wanted more change and moderates who didn't want very much change. Who do you think was right?
Probably somewhere in the middle. I think they're both going to have to give some and meet in the middle to get it accomplished.
Jason Steveson, is Utah better off for the Republican debacle or worse?
Well, you look at some of the national predictions of 24 million Americans losing their health care coverage if this bill would have come to pass. And I think you would have seen that similar impact here. So the people who have health insurance and are using it probably would have faced a lot of turmoil if that bill had happened. So I think better off now. But as the representative said, we still need to fix the Affordable Care Act.
Now, if my understanding is that the 24 million, but some of those may have lost their coverage, but a lot of them would have been people who didn't really want health insurance, but the Affordable Care Act says you got to buy it or pay anyway. Mm-hmm. Do you know how many of them, you know, which would be which, of just who wanted it and lost it, and who didn't want it?
There would have been millions that would have dropped their coverage with the mandate going away. That's absolutely true. But what we would have seen in a couple of years is people dropping because their costs got too high, and the subsidies that the Affordable Care Act gave them would not have been kept up under the Republican plan. Especially older and sicker people would have dropped off, and then you would have actually had the younger people jump back on once the system recovered. So it would have kind of turned things upside down from where they are now.
Mr. Croshaw, let me ask you. You're a sharp pencil. You know about costs. Could you talk a little bit about healthcare costs nationally?
Sure. Some of the confusion in Washington stems from the fact that paying for health care is expensive, and if solving the problem is about how many people we can get on insurance, then the bill that's already the law of the land, the ACA, covers more people. If you're looking for a more affordable health care plan that covers fewer people but costs the country less money, then the plan that was being debated in Washington was your winner. So it really depends on what are we trying to solve for in this country.
Okay, generally speaking, you guys are conservatives. Let me ask you this. Can you put up with, do you advocate a system where there are people without health insurance? Is that something we need here, we should have here in America?
Well, people will have the choice. They should have the choice. What do they want health care? If they want health care, they should be able to access it. But there are many people, even with the significant subsidies today, that choose not to sign up.
Okay, but there's also some people, homeless people, adults who in Utah can't get on Medicaid, who say they'd like to get health insurance, but can't afford it.
You know, and that's true. We have tens of thousands of children in Utah that are eligible for Medicaid today that have not enrolled. So in spite of the outreach and the efforts to get them on, they have not signed up, or their parents haven't signed them up.
Mm-hmm. Sandra Hollins, you're where the rubber meets the road. You take care of homeless adults who are on substance abuse and mental health.
yes.
Okay, how do most of them get paid for? Where's the money come from for what you do?
The money comes from the county for substance abuse treatment. The majority of my clients, as you say, they live on the street. And when they're ready to get into treatment, most of them cannot have access to treatment because then there's a waiting list.
How long?
It's 3 to 4 months to try to get into treatment.
Okay, I'm a homeless adult, I'm mentally ill, and I say, please help me, and you say, come see me in June or July.
Yes, yes, and which is that period of time when someone is ready to get into treatment. If you know substance abuse treatment, you have to move right away.
Okay, but you say ready to get in. My understanding is a lot of them that they aren't ready. They shoplift or get caught using drugs, and the judge says you can go see Representative Hollins or you can go to jail.
And there's a variety of reasons why people seek treatment. Some people are ordered to treatment, some people are ready to go to treatment. And so that is one aspect of it.
The county says they need more money to get people to her faster. Did you give them any?
We did give them some millions of dollars this year. They do need more money. I agree with that. But treatment, you don't cure somebody, all right? You help them manage their addiction and their behavior, and that's a long-term process. And like Representative Hollins says, they need to want to do it.
Okay, you like to talk about mental health and mental health parity and the difference between the plans. Tell us about it.
Well, sure. One thing the Affordable Care Act did is it brought in these 10 essential health benefits, which actually at the very end of the American Health Care Act, the GOP bill, was on the chopping block. And one of those essential health benefits is mental health care and mental health parity, which means that you don't have to have a limit on how many times you seek mental health. There's no artificial cap to it. It's a big thing here in Utah where we have a lot of mental health issues and a growing opioid crisis that we need to deal with. Those are essential health benefits that the ACA provides and that I think a lot of people would like to have continue.
Do you know if we did them before the ACA?
There were plans out there that had it available. They were not required like they are under the essential health benefit now, but still many plans offered it.
Oh.
But in fairness, some of them offered at a reduced benefit level.
Mr. Croshaw, do you know what to do? If you were king, would things be better?
It's an incredibly complex problem. I'm not sure there are any easy answers because it's a scarce service, healthcare. It costs money, and yet we're a compassionate nation. So I think it starts with determining what we're solving for and then making the best use of those funds. Frankly, we have a broken healthcare system in the sense that it's incredibly high cost. It's not focused on the management of chronic disease and population health over time. It treats acute illness, so we're spending our money in the wrong places.
When progressives get after conservatives, they say, what we need is more government. Look at Sweden, look at Canada, look at they point almost any direction. They say they pay less and get more. Is that true?
Again, I think I'd have to say, Rod, it depends. And it depends because there is lots of different healthcare spending. There is acute care spending. I'm talking about hospital services and even some doctor's visits. And then there's social services and the social spending that determines health. Things like access to clean water, even access to education and behavioral health treatment. And so when we look at comparisons across nations, we're not always comparing the same buckets.
We're going to take a commercial break, then we'll be back and we'll talk some more about health care. We're back. We're talking about health care. Jim Dunnigan, Republican representative and the leader on health care in the legislature for the last few years. I asked Mr. Croshaw if people say other countries have more government, better health care, lower costs. Are your capitalist prejudices costing us in health care?
You know, I was reading an article yesterday and it had the quote from President Reagan that said that the most terrifying words in the English language are, I'm from the government and I'm here to help. So if you look over the last several years, we've had a massive dose of government regulation in our healthcare system. The number of uninsured has gone down. However, the pricing for the premiums, the insurance costs have gone way up. Deductibles have gone way up. So the benefits have gone down and yet the costs have gone up. if government's helping us do that, I don't know how much more help we can absorb.
Okay, so you think that Obamacare, you think we'd be better off at it if we'd never heard it?
I think it was in a very expensive way to try to decrease the number of uninsured.
Jason Steveson, them's fighting words.
That's
I
right.
guess. Okay.
So my 60-year-old nanny, Utah born and raised, actually in Representative Dunnigan's district, she used to pay $800 a month for her health insurance because of a pre-existing condition. She could barely hold on to that. Along comes the Affordable Care Act. Age rating changes, pre-existing conditions go away. She can pay $200 a month for her health insurance, save up for her husband's kidney transplant, which he definitely needed. This is how the Affordable Care Act helps people afford insurance.
A lot of people on your side say we really need Medicare for everybody, or we really need single payer, or we at least need a government option. Do we need a lot more government?
You know, the single payer issue actually, I would say, crosses party lines. There's a lot of folks on the Republican or conservative or libertarian side who now see that as a viable solution. But there's one thing I would say about government and what the Affordable Care Act did. It used to be that your insurance company stood between you and health care. They would deny you because of pre-existing conditions. They would tell your doctor that they couldn't do that because it wasn't on the approved list. The Affordable Care Act took the insurance company out of the way of between you and your doctor and made it so that you could work with your doctor on your care, and that you didn't have pre-existing conditions, you didn't have crazy approval processes you had to get through like you had before. So it did help people, and when you say take government out of healthcare, what you'd often have is you'd have insurance companies move back into that spot.
Do you favor single payer or Medicare for everybody, or a big government, a larger role for government, significantly larger?
Personally, I don't see that's feasible in the United States with our system. I would prefer something like a Swiss model, where you have a layer of public health care that establishes a benchmark and then extra is added on top for people with employer-based insurance.
Representative Sandra Hollins, does Obamacare made things better for you and your poor clients, worse or the same?
You know, I see Obamacare as being better. You know, it's not perfect by any means, but it's a framework, and I would like to see, instead of repeal and replace, fix and repair.
Okay, now for you and your clients, you see people every day. Do you get them? Do they get in faster? Do you get paid better, or are things better for you and them?
You know, I would have to say things are better. What I would like to see for my clients is full Medicaid expansion. Is what I would, if I was queen for the day.
Okay, okay, let's talk about that. You said once, I heard you, if they'd let us limit it to 100% of poverty instead of 138, we would expand Medicaid. Obama's administration wouldn't do that. Trump administration, might they do that? And if they did, would you do it?
Well, that's a great question. I went with Governor Herbert back to Washington a couple of times, met with Secretary of HHS. We offered that. Let us expand to 100% of poverty, because that's the coverage gap. That will take care of everybody in the coverage gap. And they said no. We requested, along with other states, they said no. I don't know if the new administration will offer that or not.
Will you ask? Will you and Governor Herbert go back again?
We are asking for a variety of different things for flexibility. We have asked, and we'll continue to ask.
So even without changing Obamacare, even without that, we may get full Medicaid expansion here in Utah because, or at least like full Medicaid expansion, because of differences in the Trump administration.
I am not saying that. I am not saying that. I'm saying we want more flexibility to have more control over the Medicaid dollar, so we can decide the benefits that we're going to offer, and if people should work, if they're healthy, and other things like that.
And Rod, I'll just add that Administrator Firma, who now runs CMS, the federal government agency that runs Medicaid, has sent out a letter to governors saying that they're inviting a discussion about more flexibility for states, things that they would be willing to approve that the previous administration wouldn't be able to approve, things like work requirements or job training, the kinds of flexibility that some states have sought and not been able to achieve in the past.
Are you guys for flexibility?
I think our organization would be in favor of closing the gap. And we've seen Kansas move this week. Their legislature passed a bill to close their Medicaid coverage gap. There's movement in Virginia again, in Georgia. Does Utah want to be the last to do this? I don't think so. So if there's a way to close the gap and do it that's helps people and is fiscally responsible, Utah could probably find a way, and I think we'd support something like that.
We had viewers write on Facebook and ask a question. She says, her name's Amy, and she says, how can we hold down drug prices? Indeed a conundrum. Do you have anything to say about it?
There's a big soft target out there, and that is negotiating in bulk for Medicare prescription drug prices. Something that President Trump has initially said he was in favor of. I think he has maybe changed his mind on that. But that would be a big way to impact what prescription drugs cost, because a lot of insurance companies base what they pay based on what the Medicare rates are. So if we can do that for Medicare, that's 60, 70 million Americans, we can make a big dent in those.
So Medicare and Medicaid would do the negotiating, but then those prices would tend to go through the market.
It would trickle down. That tends to be what happens when you have a single big buyer like Medicare.
Would you like that idea? Cheaper drugs because the government twists arms?
I favor more competition, and we already negotiate, belong to a consortium for our Medicaid drugs. Medicare, of course, is a federal program. If they get the drug pricing down for Medicare, I agree that's going to drive it down for some of the other payers as well.
What's wrong with it?
With lowering drug prices?
Nothing. With the government saying Medicare and going to the drug companies and saying, and beating on them. They could beat them down some.
They could, and there's also talk about importation, where you're bringing the less expensive drugs out from outside the country. There's concerns with that. Do you have the same quality and things like that?
But now my understanding is this: you can buy American drugs cheaper in Canada, and in fact, you could go up to Canada, buy American drugs, and bring them back here and sell them cheaper than we're paying for them here, at least in some cases. That's what I've heard. Is that so?
You can certainly do that for some drugs, yes.
So what's wrong with the government beating on the drug companies?
If it brings down drug prices, I think that may be a good idea.
Do you have a problem with the government beating on with his idea?
Well, I think all of us in this country are interested in a safe drug supply. And the FDA is the agency in this country that's charged with guaranteeing that the supply of drugs that we consume is not counterfeit, that it's not adulterated in some way. What the FDA has said is that they cannot guarantee that anything that's being re-imported is safe and effective.
Okay, but that's re-importation. What about the government just getting tough with the drug companies?
So again, I think this goes to what is the appropriate sensitivity we have to a robust and vibrant marketplace. I would suggest that pharmaceutical companies some of them have gone too far in the rate of price increase for their drugs. The sad fact is that most other countries in the world already use the government to bring down drug prices so much that this country is really funding the innovation that's driving new medicines for the entire world. If we do what other countries are doing, we would probably kill the goose that laid the golden egg.
Quick, if we did it, would we run out of new drugs?
I don't think so. I mean, there's the vibrant drug companies in Israel and other countries that do quite well. Why does a Kindle cost $400 a couple years ago and cost $90 or $70 now, but insulin has gone up 300% in the past couple of years? That doesn't make sense. Insulin's been around for a long time. And obviously there are some different market forces, but a lot of it has to do with pharmaceutical companies in states like New Jersey and Delaware pushing the levers of power and saying, you know what, we're not going to bargain that way because it affects our bottom line.
Commercial break. We'll be back after this. Jason Steveson, Senator Mike Lee at the start said Washington has taken over administrative control, regulatory control. Would you talk about that? What have they given us?
Well, you know, the last thing that was kind of put into the Republican bill was getting rid of essential health benefits. And if we could be perfectly omniscient and predict what was going to go wrong with us for the next year, that would work, right? You could say, oh, I'm going to break my arm, I'm going to have some knee trouble, I'm going to sign up for that. But it's like having the fire department come out to your house, if you had insurance like that, and they look at your fire in your house and they say, oh, look, this is a kitchen fire. We only put out attic fires. Tough luck. That's what insurance would be like if you could pick and choose and you guessed wrong.
You tell us a little bit about the people you serve and how this affects them.
You know, I just want to make sure as we're looking at numbers and data that we remember that there's a human side to this, to this crisis that's going on, that we do have seniors in our community who have to make the choice daily of whether they're going to purchase medicine or whether they're going to purchase food. And so, and we have people out there who are dying or who need life-saving medical interventions. And so for every person out there that there's a story that this does not work for, that there's someone out there that it does work for.
You stand for a principle in this. What is it?
Less government, let the marketplace work, provide affordable access to care for as many people as we can, but give them the choice. We need the young invincibles in our risk pool, and yet the Affordable Care Act requires them to pay more than they should to subsidize the older people, and then we're surprised that they're not signing up for insurance.
Okay, and you have some final words of wisdom.
Rod, I have 5 children, and those children are going to have to figure out, as they grow up, how to live within their means and pay the debt back that we're incurring. This year alone, in this country, we will add $600 billion to our national debt. We have to figure out how to provide health care compassionately within the context of what's sustainable and affordable. And so as we evaluate benefits, we also need to evaluate the affordability feature for the long term, for our children.
We're out of time. Thank you very much. Good night.